start. Hello, today we are going to be doing the cardiovascular exam on this patient. So the patient is laying supine with their knees flexed, and we have tangential lighting so we can see. I've already undergone the proper hand washing techniques, and I'm wearing professional clothing, a lab coat, my name tag is visible. So is it okay if we get started? So what is your name and your date of birth?
And I'm born in 2015, August 12th.
Okay, so for the purpose of this exam, we would normally expose the patient's chest, but for this video presentation, we will not be doing that. So we're going to start by inspecting. So I'm going to inspect the anterior chest, and I'm going to look for any apical impulses, any pericordial movements, any scars, any deformities. I'm also going to look tangentially at the chest on both sides, and I'm also looking for any apical impulses, any deformities, any scars, any lips, any heaves, which I don't see, so I'm going to move on to the palpation portion of the exam. So I'm going to use the MCPs of my hand to palpate thrills, and I'm going to use the pads of my fingers for pulsations. For context, this is the patient's right side, and this is the patient's left side. So we're going to start by palpating the second intercostal space, right side peristernally, and that is for the aortic region. So thrills, pulsations. Then we are going to assess the pulmonic area, which is the left second intercostal space peristernally, thrills and pulsations. Then we are going to palpate the left peristernal third, fourth, fifth intercostal space, and that is for the right ventricle. Thrills, pulsations. Next, we are going to move on to the left side mid-clavicular fifth intercostal space, and this is for the left ventricle. And again, we are going to assess the thrills and pulsations. Lastly, we are going to do the thrills in the epicastrum region and pulsations. We're going to do superficially and deep. Now we've concluded the palpation portion of the exam, so we can move on to the auscultation portion of the exam using the stethoscope. So we are going to auscultate the carotid arteries first for bruits. So side. Right carotid, left carotid, and we hear no bruits on either side, so we are going to move on to auscultating in the other regions, the valves. So putting 2 fingers on one of the carotid arteries, we are going to listen to the right second intercostal space, peristernal, for the aortic valve. And we're going to listen to the left second intercostal space peristernally for the pulmonic valve. And then we are going to listen to the third intercostal space, which is known as the Erb's point. And I'm going to have the patient take in a deep breath in for me, please, and let it out. Okay, now we're going to move on to the fourth intercostal space. And this is the tricuspid valve. Then we're going to move to the fifth intercostal space on the left side, mid-clavicularly peristernal, and we are listening to the mitral valve. Then would you mind lifting this arm a little bit to the side? Yes, and we're going to listen to the left axilla sound, which is the third intercostal space, mid-axillary. And now we are going to auscultate all of the same regions using the bell of the stethoscope. So again, the right second intercostal space peristernally is the aortic valve. Then the second intercostal space left peristernal, we are going to listen to the pulmonic valve. Then again, for the Erb's point, which is the third intercostal space, would you please take a deep breath in for me and let it out? Good. And then the fourth intercostal space is the tricuspid valve, left side, peristernal. Then the fifth midclavicular intercostal space, left side, we are listening to the mitral valve. And then again, could you lift your arms slightly? We're going to listen to the axilla sound using the bell, and it's the third intercostal space, mid-axillary, left side. Okay, and you're supposed to have your fingers on the carotid arteries at all times as you are doing that presentation. Okay, so now we are going to move on to auscultating the bruits. So I'm going to start by listening to the abdominal aorta for any bruits. And then we are going to listen to the renal arteries. And I'm going to listen to the iliac arteries and the femoral arteries as well. And then you would listen to the carotid for bruit, but we already did that, so we can move on to assessing the pulses and the edemas of the extremities. So we're going to start by looking at the extremities. So we are going to look at the arms and the legs, and we're looking for any color differences that are not normal. If there's any edema, if there's any change in the hair pattern, vascular distribution, which we do not see. So I'm going to move on to assessing edema in the calves. And there's no edema in the calves, so we can move on to looking at the palpating the arteries. So we're going to start by doing the inner arm on both sides and assess the brachial arteries. Then we are going to assess the ulnar arteries. And then we'll do the radial arteries on both sides, just on the thumb side. And then we will also palpate the carotid arteries. And then we will palpate the femoral arteries. And then we will palpate the popliteal arteries. And then the posterior tibial arteries underneath the medial malleolus, both sides. And then the dorsal pedis arteries, anterior part of the foot. And then we are going to assess edema on the dorsum of the foot, as well as the anterior ankles. And then the distal tibia as well. And then the proximal tibia. And then you're going to thank your patient for their time and their cooperation during this exam, and you're going to make sure that they are appropriately dressed before having them kindly exit the room. Thank you. That wasn't so bad.
What time is it?